Well, here we go. Hi, everyone. Welcome. And let's get cracking because we only have half an hour for this really important topic that we're going to be talking about today. Thank you all for joining. We know that time is valuable. There's just so much going on in our lives right now and in our work as well. We're struggling with the surge in the Delta variant, even as a health system. There's just so much going on the ground right now. So everyone's time is really valuable. But we're here to discuss one of perhaps the most pressing issues facing healthcare today, the increasing desire for on-demand, individualized care. We're ultimately progressing towards a system in which multiple care stakeholders can really empower individuals of varying economic status, social class, and technical skills to make proactive decisions about their own health outcomes. And especially at a time like this, where we're still living through this pandemic, where we're dealing with so many different challenges that are coming at us, both personally as well as professionally, a topic such as this around personalized, proactive, and ubiquitous care, and how we get to the health and well-being journey that we know need to be prioritized, especially at a time like this, is really critical. To achieve such personalized and ubiquitous care, we have to concurrently explore the types of digital transformations the healthcare space must prioritize. And prioritization is key because we've got all of these different elements of priorities that are just barking for attention from us. And for us to prioritize some of these components around well-being and health equity for all is really critical. Hi, everyone. My name is Dr. Rasu Shrestha. I'm a radiologist by background and EVP and Chief Strategy and Transformation Officer for Atrium Health. I'll be both your moderator as well as a participant in our engaging dialogue today on this important topic. You know, Atrium Health's mission is to improve health, elevate hope, and advance healing for all. And I think that's really relevant for the topic that we're talking about today. Joining me today are two experts in this field, and I'm really excited to have these two experts and friends of mine in this conversation today. Lisa Esch is the Senior Vice President of Entity Data Services. Lisa, welcome.
Thank you, Rasu.
And Dr. Michael Peterson, Mike, is the Vice President of Consulting and Chief Clinical Innovation Officer for Entity Data Services. Mike, welcome.
Thanks, Rasu.
Well, together, Lisa and Mike bring decades of experience in the healthcare field, especially in healthcare innovation. So we'll have about 15 to 20 minutes of conversation here, and we'll take live audience questions as well. So this is your opportunity, audience, as you're chiming into LinkedIn Live here. Please, don't wait until the last minute. Plop in your questions, and we'll try to address them towards the end of our dialogue that I know will go really quickly. So with that, Lisa, Mike, let's dive in.
Great.
Thank you. Thanks. So I thought, we should really start with talking first and foremost about accessibility to equitable healthcare, because I think that's really important, right? So in the midst of everything that I talked about earlier, the for all part of our mission statement here at Atrium Health is something that we think about very often in the specifics of how we innovate, how we strategize, and how we connect with our community members on a day in, day out basis. But accessibility to equitable healthcare is far from ubiquitous in this country, much less globally. So the question for all of us, and I'll put this in front of the two of you first, is before we can discuss the individualization of care, do we have to first bridge the economic and the social divides that really prevent equal access to health services? So Lisa, let's start with you, please.
I'll start. I think we do, and it's challenging. These are topics that we've spent decades trying to solve for. It's not new, but I think our world today really contributed to a different way of looking at it, and actually accentuating the disparity that's out there, and has even created more divides. And we think about all the digital health, digital access, digital medicine, telehealth, and how digital helped bridge some of that, but for others, it created even more of a divide. And so there are some challenges out there about how we address those types of challenges that each community has. And healthcare is local. It's different in different communities. And it's not a one size fits all solution because, it's local. And we have to empower communities to come together with healthcare providers to look at the options to work through these types of things. And as a tech company and a people and services company, we have to make sure we're not contributing to the digital divide that can happen when healthcare goes more digital.
Yeah, that's a great point, Lisa. I actually talk about how we are in the global economy, right? It is global in nature, but it really is local. To your point, healthcare is very local, but then what happens at a global scale impacts the specifics of what we're doing locally and vice versa as well. And we've seen that play out front and center with the pandemic. What started in Wuhan, China is affecting us in every corner of our local communities in a way that we never thought we would be affected. So Mike, what specific digital solutions do you envision solving these fundamental issues?
Yeah, thanks for the question, Ross. I really think that Lisa nailed it. We have data that shows that where there are gaps in our healthcare system. JAMA just released an article that from 1999 to 2018, the disparities and the gaps have widened. And what we really have is an imperative to truly solve for these. And the pandemic has forced us to think about that. So when you really think about post-pandemic or continuing pandemic care, when we think of digital tools, we have to think of tools that really can be consumed in a way that is culturally competent, that has digital literacy and health literacy, but it's convenient and seamless. So when we really think about how we're going to address them with digital tools, you can't just create an app and nobody uses it. You really have to try to solve a problem. If you think about all of the tools we use today, they're solving needs. And in health, with it being so fragmented, either through communication or lack of understanding, if you could just build a digital tool that actually solves what someone's looking to solve for, I think that's what we can do best. So I think what we really are seeing are a lot of the health systems trying to get there, but they're trying to solve it all at one time. And I think you really have to do it along clinical journeys and do it along a path for the patient from the beginning, from the digital front door to the moment that they get discharged from the house.
Well, that's a great point, Mike. And one thing is certain is that the pandemic's really accentuated the existing cracks and fault lines in how care is delivered and the many inherent biases that we have in the what, the how, and the whys of healthcare, right? And so what we're talking about here today is how do we really use this moment in time to rise to the challenge of really addressing those cracks and fault lines that we know exist in healthcare that's been accentuated as a result of the pandemic. And I think it does start first and foremost with that patient, with engaging that person that's at the other end, having the right conversations, making sure that we have empathy-based approaches to how it is that we continue to innovate and actually solve for these. So we're not creating solutions that really just fly over their heads, that really don't speak to them, that N of one, that we're actually building it with them and for them. So really good points there.
Yeah, and you're probably seeing this at Atrium, where the point solutions, the way we try to typically solve things, can actually overcomplicate the access in all the different places and portals. So we've got to make sure that as we move forward, that we simplify it and not continue to overcomplicate it.
Yeah, no, absolutely. It's a great point. One of the things that we're continuing to push forward here at Atrium, and I believe is going to be a key priority for us across the industry, is really elevating ourselves from the transactional layers of healthcare delivery, which is where we've been stuck in for decades at a time, to more of the experiential elements of healthcare delivery. What does that experience really look like, right? And we've seen that even in the last 18 months of this journey of living through the pandemic, where it's not us just pushing virtual care. Right. There is a pull. Our patients, our consumers, our customers are demanding for better experiences in terms of how care is being parlayed. That really brings me to the next question, which is around the holes in our healthcare system, right? What are the holes that we have in our healthcare system that's been exposed by the COVID-19 pandemic?
So I really think that what we've seen are what you just described, is that our healthcare system, specifically in the provider space, we have to get past this episodic reactive care model. And we are going to see it in an evolving, as you described, this human by design, empathetic experiences that really solve getting people to think about, and when I say people, just our own industry, to stop thinking episodic, to stop thinking reactive. So some of the big gaps that we saw, one is really this inability to have PPE, right? We've known this was the most predictable pandemic about to happen, but yet no one really prepped. But yet you saw all of the tech companies have millions of PPE and N95 masks available. They really planned for this. And so what I think, when we shift into a evolving COVID world and the next pandemic, what we have to do as we think of health is a proactive, more engaged with the patient, so that patients are going to start consuming health now in what's fragmented in a space that they personalize for themselves before they even touch the health system. So health systems really have to figure out how are they going to partner with patients and get them to be engaged in their milieu of delivery of care. So I think the models of care will change to be more proactive, and the way that's reimbursed will evolve from that perspective too. And again, it has to be healthcare for all. So there's going to be this equity. There's an imperative for innovation and equity, or you'll get left behind. People will go to the place that they feel comfortable with. And I think the last thing we'll say too is a gap that was missing as we think of not just testing and at the outbreak of the COVID pandemic, but also hesitancy and a lack of trust. And it's trust not just with the health system or the vaccine, but it's also trust within the healthcare ecosystem, whether it's community-based organizations and their relationships with the health system. We have to have trust across the whole ecosystem, or we will see that a lot of these efforts will fall flat.
You're well said, Mike. And I always said that the antidote to the massive distrust in information and privacy concerns that we're seeing out there right now is not information blocking, it's open data, it's open APIs, and more open policies. And I think it's that trifecta that we need to continue to push for across the industry. We're seeing that in troves here. So, as we're continuing to push on forward at Atrium around what we're calling our community immunity for all, and focusing in on the specifics of things like our vaccine hesitancy task force, or the real-time data elements that we're using to drive forward with our COVID-19 vaccine demographic electronic dashboard, or leveraging technologies and capabilities like the geographic information system mapping, like the GIS capabilities, that really allows for us to hone in on specific zip codes. And then armed with that data, we can send our roving testing and vaccination units to the areas of greatest needs and inequity in the communities that we serve. I think it's these sorts of initiatives that will really continue to drive the change that we know need to happen forward. So Lisa, what are your thoughts around this? What do you believe when we talk about the holes in the healthcare system in terms of where we need to refocus our resources?
So I think that Mike was just touching on this as well, and you did, is it's anchored in trust. Healthcare is a personal relationship between a provider and a patient. And we've got to reestablish this element of trust and trustworthiness from my data. Having access to it, having it be so hard to get my information, and it's the subtleties of information blocking and all that. And data is now the new currency. So how does an organization that's invested in this keep it or share it? And so you have this trust, that anchors that. But there's also the lack of trust about information, we've got to overcome this trust issue. And again, it's local. There's national messages, there's global messages, but for this to really make an impact in a community, the community and healthcare have to come together to solve this together and reach out in ways that are trusted and that can really regain the trust.
Yeah.
Rasu, just quickly, I was going to say what Atrium and the other health systems in Charlotte did, and a lot of systems did across the United States at the outbreak, was they just put the guns and knives away and they worked together, they collaborated. And you created One Charlotte, where you create these really unique partnerships and collaborations to really solve unique problems. And I think the future of healthcare is going to be an ecosystem of collaborative partners that are so dynamic and so diverse that you wouldn't think that Ford Motor Company would make ventilators, right, out of an emergency. So how do we proactively pull in sort of your atypical partnerships? But it's collaboration, and that collaboration is trust. And Lisa nailed it, which is, how do I trust the physician or the clinician? And how do I trust, and then within the clinician, how do I trust that the systems I'm working in, the data I'm looking at, are unbiased, or that the data that I'm looking at is giving me the full view and scope of the patient, so I can make the best decision for what's important to them.
And sometimes that takes, I'm sorry.
No, please, Lisa, go on.
Sometimes that takes an outside point of view to help guide you through that, because healthcare systems are tradition laden, like healthcare and how we educate, how we engage, how we interact. There's a lot of tradition there. But we have new technologies, new ways of thinking, new ways to engage, and it sometimes takes an outside perspective to help you get on the map or the plan that you need to for your community. And it isn't one size fits all. I do see we have a question. So I'm going to put this at the panel. How do you rebuild trust if you've lost it through a data breach or an incident that has eroded trust?
Yeah, that's a great question. And I'm so glad that that question was asked,
Me
because
too.
it is such an important question. And the reality is that I think, for us to really rebuild that trust, because trust is so difficult to build, yet so easy to break. And we all know this, we need to make sure that we're listening. We need to make sure that we're connecting. We need to make sure that we're actually partnering in the right ways as well. So the specifics of the public-private partnerships, Mike, that you alluded to, that we're leading the charge here at Atrium and across the communities, the fact that we're actually sitting down with our community leaders and having these listening tours, because I think that's really important too. And then speaking in the language that resonates most with the folks that we're interacting with. I think that's really important too, because all of this executive speak, the flashy, bells and whistles that oftentimes just fly over their heads. I think that it's important for us to make sure that we have the right language that can, really transcend these barriers that we've been erecting as a result of sort of, the lack of communications that we've been having for a very long time, not just for the last 18 months, but really for centuries at a time. When we look at the inequities that exist out there, I think that's the challenge at hand, is to really break through all of that.
No, I would agree. And I think that, organizations, we're seeing it every day. We saw the headlines this morning. I mean, many on this call today, in this session, probably were impacted by the one that was announced today. And it was not healthcare, but it's still personal. And so it isn't just healthcare that's attacked with this. How do you regain the trust? And I think that there's an important, communication that needs to happen. But we also need to reflect, like, where's our responsibility in this as organizations in protecting from this, and what are we doing, and how do we rebuild that trust? I think it's unique to each organization based on what's happening, but it takes a lot of time to rebuild that trust.
Absolutely.
Yeah, I think there's a notion about transparency, but remember, in the future, the way we have an expectation for consumer experience that's seamless, people will flock to the care experience that is seamless and convenient, but also trusted. But when they think of that, they're going to go to the one that has through transparency is this trust piece. But it's about a relationship, right?
Yeah.
We have a relationship with our, your cell phone company and all these other consumer themes. They're limited in some ways. Health is a lot more complicated, but your relationship with your health system should not be around this notion of a waiting room. I will wait for the physician, sitting in the OR waiting for these things to happen. We have to be really proactive for ourselves. And then when you have an engagement tool and you have an experience that allows you to engage when you want, how you want, moving forward, and it's equitable for everybody. So you do solve for the digital divide, you solve for health literacy, you bring cultural competency. And I think you said it best too, is that a lot of health systems now, what they have learned in this post-pandemic era is you actually have to get into the community. Health equity is hard work. Delivering this care for those underserved isn't just about the technology. Sometimes it's just about going door to door and creating ways to bridge that door to the health system. And maybe it might be through partners and community-based organizations. So I think that's how you build trust, and it takes time. So
I completely agree with you there in terms of that's how you build the right partnerships. And, we just got a question from the audience: is health equity a technology issue or a policy issue? And how do the two really overlap? And I think that's a great question, and it speaks to exactly what you're talking about there as well. And Mike, my perspective on this is that, it is interdependent, it is interwoven. And we've seen that play out time and again for decades at a time here in the United States, how the right policy decisions can actually really expedite the elements of how technology is embraced in healthcare. So whether it's with the Affordable Care Act, whether it's with the high-tech elements of how we're able to really push things forward, we're seeing that time and time again. And I think the pandemic is another example of that with virtual care. What are your thoughts?
Yeah, I think I was just quickly, Lisa, I was going to say they're inexorably linked. And I think you're right. If you look at the data that comes out of the COVID pandemic, that data is built on technology, and those technologies and the data and all the information inform policy, inform guidance, inform things. We'd like it to be more real time, but as we move forward, I think policy is delayed in the way that it's developed, but it's always, well, I won't say always, it's generally helping to change with the data that they receive. So I think they're hand in hand. I think technology enables the ability to drive, but I also think it's going to be driven outside of policy. There's a lot of other stakeholders that help drive health equity, but I think, again, technology and data are usually the enablers for that. Sorry, Lisa.
No, go ahead. And you guys have covered some really important issues. I want to just, as I look at this, I agree it overlaps. They're intertwined. I just want to make sure that technology doesn't contribute to it getting worse, okay? Because it can. It truly can create more of a divide. And so we want to make sure that it doesn't do that. And there's a way to have it help solve the problem and not contribute to the problem. And so that's what we have to be aware of. It isn't just a simple answer. It really is coming together and tackling and addressing those things anchored in trust.
Well, that's a great point. There's one other question here about what are the long-term and short-term innovations that we're all working on specifically in advancing accessibility. And I can tell you this, that, at Atrium Health, one of the things that we're really doing, especially, pertinent to the conversation today about preventative care and proactive interventions, is we're really widening the aperture. And we're saying, look, it's not just about patient-centered care. And I think patient-centered care is important, but it is about looking at this more holistically from a person-centered care approach and saying, look, it's not just about the episodic care elements. When I need care, I go in and I get care. How do we broaden this to where it is always on, ubiquitous 24/7 care, where it's not just about surviving from a critical illness or getting better from a specific ailment that I have, but it really is not just focused in on wellness and preventative issues, but really focused in on thriving. And I think until we get to that element, then we're not really going to crack the nut here in terms of the healthcare economics of what drives these models forward. And that's what we're really focused in on here at Atrium, is to look at care transformation in a way that really widens that aperture and looks at the entire elements of the multi different factors that go into the elements of what thriving really looks like. But yeah, Lisa, let me know your thoughts.
I think you nailed it, because what this really is, it's a transformation in care delivery and how we think about receiving healthcare and delivering healthcare. And it's moving outside the four walls every single day that passes. There's less care that happens inside the four walls than will happen outside the four walls. And there's an empowerment in that, but there's also, it can be paralyzing to some. So we have to acknowledge that and just really explore these new ways of engaging in whole person care that goes way beyond the episode of care that we're seeing right now.
Yeah, I also think too, it's how you define what care is. I think right now, in the sort of layperson's point of view, it's I am sick, I go to the doctor, but health, so the way we define care at NTT Data is it's about social care, it's mental health or behavioral health care, and actual physical health care. And the three of them make up the health and well-being of a person. And they're dynamic and unique for each person. They're not going to be equal across. And the future is that, for short term, mental health and behavioral health is to me, a space where you can innovate, especially with the advent of what we saw in the pandemic from telehealth and virtual health. And not everybody needs a therapist. They may need some form of a digital experience or virtual care experience. And then when you go from a long-term perspective, you start to look at how does data really drive a clinician's decision around all of those three things and balance the top using artificial intelligence and machine learning to say, Mike Peterson's here for this problem, but it turns out if we solve these two as well, it will put them in a care pathway that gives them the best outcomes. And that's really what we want to, this way we think about it is it's all outcome based, but if you start to invest early and have the data and proactive interventions on the back end, you're going to really have a lower cost of care. You're going to have a lot of value that you'll be able to bring and reinvest in your healthcare systems.
Well, thank you. Yeah, really great response there. And thank you for also talking about the cost of care. So I know we're almost running out of time here, but as we wrap up, how about each one of us share the one thing that you're really excited about as it relates to personalized, proactive, ubiquitous care, the promise of all of that. So what's the one thing that's really exciting or what excites you the most? Lisa, let me start with you.
Yeah, I'll go first. I think that we're really focusing on, digital can seem cold and the humanizing piece that can happen with digital. So we can humanize that digital experience and have it be more patient-centric and patient-focused versus just technology-focused. So that change from a technology focus to really a personal focus and having a humanized experience, even though it's digital, I'm really excited about the things that we're seeing.
That's a really great point. Mike?
Yeah, I'm absolutely excited about all the sort of the ability to stitch and solve the challenge for health systems who are finally saying, you know what, we need help. And so being able to take all these different applications and different technologies, different sort of consumer patient experiences, and being able to thread them and integrate them into a care journey. And so for me, one of the most exciting spaces this can happen is if you look at Motherly, which is a digital social tool, but they're kind of blending in, and you blend them in with all of the other mother-baby experiences and go along this clinical journey so that you start to create from the beginning all the way to the fourth trimester a way to help. And through that journey, you're solving for postpartum depression, the mental health piece, you're solving for the actual physical health piece, and then you're really solving for the engagement piece. So I really get excited about how you're able to stitch and thread complicated systems on the reality is, right, Rasu, is that the patient doesn't care what's on the back end, whether it's Python and what data and this, that. They just want to know if their baby's okay, or if they need to take a medicine or get a work note. Sometimes it's incredibly simple, but focusing on what's important to the patient. And I love it. It's really about, the health of me and how they go along these journeys is going to be the way the future will go. And it has to be blended with a health system and other entities, and they got to get really comfortable. The pandemic has taught them we can collaborate and it works.
Yeah, no, it's a great point there. And we're doing some amazing things here with baby scripts and looking at the entirety of the maternity journey, and then leveraging capabilities like what Zells brings to the table to really connect the dots between the world that the clinician resides in, i.e. their EMRs, to the world that our patients and our consumers reside in, which is not the EMR, right? So it's their apps, their tools, or the world that they live in, where they eat, work, live, and play. And that's what excites me the most. Is I think the coming down of these walls between medicine on one hand and public health on the other hand, and those walls have really come down. And I think there is a real thirst, a hunger that we're seeing from our patients and our communities for science and for evidence, even amidst some of the questionings that we're seeing out there. I think the reality there is if we can really demonstrate not just the efficacies from a science perspective, but really what does it mean for that N of one? And how does it really move the needle in your health, in your well-being, in the outcomes that we're driving for the communities that you're a part of? And if we can really translate that into medicine, into the delivery of healthcare, which I think is what we're starting to do right now, that's what really excites me as well. It's a really great conversation, and I think we could carry on forever talking about this, especially with the two of you. So thank you for an engaging dialogue. Audience and everyone here, let's carry on the conversation. This is just the start. Engage with me directly, or Mike or Lisa online on social media and through various forums, but let's carry on the dialogue. We need to keep going, and we need to make sure that we deliver to the promise of personalized care and do this in such a way that it truly is differentiating for us as we come out on the other side of the pandemic. Thank you.
Thank you,
Thank you,
Rasu.
Rasu.